Welcome. We're at the Long Island United's Call to Action in Saving Lives at the Melville Marriott. Today's event was made possible by North Shore LIJ Health System and is a partnership between the alcoholism and substance abuse providers of New York State, the New York Society of Addiction Medicine and Friends for Recovery, along with the Nassau and Suffolk coalitions. And we are very happy to have over 250 people gathered today to talk about addiction in our community and ways we all can work together to combat this epidemic.
I came to the summit today to be a part of a collaborative effort among providers across Long Island and prevention, treatment, recovery, in order to figure out how we best can work together to reduce the incidence of drug abuse on Long Island.
Our goal today is to bring all of the stakeholders from the community together to have a conversation, to continue the conversation of how we all can work together in providing access to care and helping those in needs of addiction services to find it, to get it, to maintain it.
You know, I work in the field and I have an interest in what's going on, and it's great to see that there are different entities that are here today. It really takes a village to be able to save people, and you know, there are a lot of different players in the game here. There are a lot of people that have the ability to make a difference. This is not really a parents-based event. This is more professionals in the field, legislators, ASAP, ASAM are here, and I think that we have the ability to make a difference if we work together. If we don't work together, it's going to be tough.
The summit is important because it speaks to many issues that we've been talking about for a long time. Mainly how to prevent further substance abuse in our communities and how to include prevention in the discussion.
Prevention is the beginning. Prevention is so very important, especially with our youth, and to giving them outlets in ways of alternative programs for fun, education. It all begins and ends with prevention.
What prevention does is it provides us with awareness and education on how to lower the risk of addiction issues and the addiction disease in our communities and for our children.
I think that prevention is important, and we forget sometimes that we tend to react to things and we don't often plan proactively to address things. And prevention is just that. It's proactive planning so that we can catch things early, so that we can teach children what is important, what they can do to help prevent from becoming addicted, what they can do to help their friends in situations, and how families can get involved in pro-social types of activities that will help them to teach their families and help their families to become prevention focused.
Something like this is so important, in my opinion, because it's all about prevention and educating. And when I was growing up, none of this was going on. You know, there was no talk. Everything was taboo, and nobody wanted to talk about it. And the only solution was just to, stricter jail time or that kind of stuff. They're actually trying to attack, you know, the root of the problem, you know, instead of just the symptom.
What brings me here is an opportunity to sit down and engage and discuss and speak with individuals on a common goal that we have to improve the situations that individuals who are impacted by addiction or those who are pursuing recovery find themselves facing. So we have an opportunity to dialogue and articulate our opinions and our ideas about how we can approach a solution in that matter.
I hope that people will learn a lot about what's happening across the island, both the difficulties that we're having as well as the creative programs that are going on, so that people can come together and work more closely to address the needs at a population level so that we can make community change around the incidence of substance abuse.
So today begins with a plenary of some very well-known speakers. Sue Foster from CASA, Andrew Kolodny, as well as Harold Pearl from NIDA in DC are here. And then we will also have a press conference made up of local community folk who have been touched by the tragedies of addiction and are committed to helping to spread the word about the importance of working together and keeping those access to care and recovery open. This afternoon we have a series of educational workshops that focus on the science of recovery, recovery coaching, physical, mental health integration, mainstreaming addiction medicine into primary care, and a number of other workshops that are centered on how the community can work together and continue to work together.
I'm here today because I was presenting on the topic of physical mental health integration and about how primary care physicians can work together with behavioral health specialists in order to implement things in their practices, in their primary care offices, to prevent substance abuse, to conduct screenings, and to help people with mental health concerns right at the front door.
Everybody is impacted by this addiction epidemic, and these offer us opportunities to approach, brainstorm, give voices to individuals who don't have voices, and actually just approach the solution. This is what this is, actually, a great approach to trying to find answers to something that's been a problem for a long time.
I think it's really important that Nassau and Suffolk are teaming up together to really try to fight this island-wide epidemic.
Well, it's clear that, we do have an epidemic. They spoke about there being an epidemic here on Long Island. It's clear that the problem is severe. It's clear that the problem has become to the point where we're losing a life every day to opioid overdose. Something has to be done. This is unacceptable. It can't continue this way.
Long Island is a very special place. It has a very good system of care, a number of providers, concerned citizens, a very impressive network. And so the continuing dialogue is always so important. And so this event is just another step in keeping everyone connected and further spreading the word that the community knows a strong network is out there to support them.